Now, it seems like yesterday, measles was a disease of the past. But over the last year, doctors have seen a resurgence fueled by unvaccinated children and adults. Close to 90 people in the United States and Mexico are currently infected, and the majority of these cases can be traced back to Disneyland. 30 of those cases are infants now quarantined in their homes. Health specialists are expecting the number of cases to increase tenfold. So let's now go to Dr. Jennifer Cadle with more on this. She's a physician and family medicine professor at Rowan University. Thank you for joining us this morning. And let's just talk about how we have seen times change when it comes to measles. In 2000, it was declared eliminated. So now with this resurgence, how scary is that?
Well, I think it's very scary. I really do. And you're right. Back in the year 2000, we really did declare measles essentially eliminated. In the last few years, however, we've seen a resurgence of cases. And we really think that's due to a couple of things. The first thing is keep in mind that elsewhere in the world, measles is still sometimes very common. You couple that with international travel, and measles can spread. The other thing that we're seeing, though, is we're seeing pockets of unvaccinated people. And that can really create a very fertile ground for measles to spread like wildfire. And those are two of the reasons why we're certainly seeing this resurgence of measles now.
And talk to us about how deadly measles really is.
Right. I think this is a really important thing to talk about because, measles tended to be a thing of the past. Before we had the measles vaccine, by the way, 3 to 4 million people every year got the measles in the United States. Now we don't see it as much, and I think people don't realize how serious it can be. Measles can cause other conditions such as pneumonia, ear infections, even swelling of the brain, something called encephalitis. And remember that people can die of the measles. Before vaccinations, 400 to 500 people died every year of the measles, so it can be deadly for some. So I think it's really important to keep in mind this is not necessarily a benign condition. It's very important to prevent.
And so are people blaming this on anti-vaxxers?
Well, I actually think that that's probably part of it. We're seeing a lot of the cases of measles that are cropping up right now in people who are unvaccinated. Certainly, our measles vaccine that we have, and I should say that we do have a measles vaccine, measles, mumps, and rubella. It's very important for everyone to get vaccinated. Usually vaccination starts around the age of 12 to 15 months for the first dose in children and then 4 to 6 years. But if a child is traveling internationally, they can get that vaccine earlier. The most important thing is to get vaccinated because this is a very contagious virus. We know that if a person has measles, there's 90% of the people around them will likely catch measles as well if they're not immune. So to answer your question, not being vaccinated does make a big difference. And yes, it's one of the reasons why we are likely seeing this increase in cases. And,
perhaps then a non-surprise in that we're seeing this happen in California. There's a lot of people in California that, who do not believe in vaccines, and doctors there can actually sign off on exemption forms. But what about for those who are vaccinated? Does that mean that you're completely in the clear, or is there any chance that you can still somehow catch measles?
Right. So, I'm a family doctor. One thing I always say is that, very few things in life are 100%, right? So we can't say that there's 100%, 100% chance that you will not become infected with measles if you get the vaccine. We do know that this is a very highly effective vaccine, and the vast majority of people who get it will be protected, and that's really the most important thing to reduce spread and to kind of keep us at these eradicated levels, which is really where we want to be, and that's super important.
And so what about those with young children? In the meantime, do you suggest that they avoid theme parks or at least Disneyland?
Well, there have been a couple of statements actually made about that, and I agree with some of the statements I've read. I would say this: if your child or you are not vaccinated, that's where a lot of the vulnerability lies. First of all, get vaccinated. But yes, you need to avoid places where cases might have been. It's really important if someone feels they may have been exposed to measles that I would say, call your doctor as opposed to coming into the office, to be honest with you. I think everything's a little bit different in terms of the case, but you may want to call your doctor and run it by them and get guidance on what to do next. But the key here is if you are unvaccinated, you're essentially not protected. And yes, it makes you vulnerable. So yes, you're going to need to be much more careful. Absolutely.